Hi, I'm Dr. Julie Steinauer, and today I wanted to talk to you about something that we use in our office for a lot of our patients called binasals. Now, let's see if you can see these. This is an old pair of glasses that we have just kind of sitting around in the office. And if you'll notice this kind of frosty stuff on the inside of the lens, that's what's a binasal. Now, binasals are used in our clinic for a lot of different purposes, but for our patients who have esotropia, where their eye turns in, we use binasals a lot. It's actually a way in which we can train the brain to align the eyes. So let's jump into that just a little bit more. When someone has the problem of esotropia where they're crossing their eyes, their right eye has learned to cross-fixate and process visual information in the left visual field. The left eye has learned to cross-fixate and process information in the right visual field. This isn't accurate. We want the right eye to actually learn how to fixate here and the left eye to learn how to fixate here in pretty much all circumstances, except for whenever they need to actually cross their eyes for the right reason up close to align to read print and see it clear. Okay, so in the normal situation, we don't want their eyes to cross at distance, so we don't want them cross-fixating. Now, one of the ways in which we can train the brain to stop this problem is to use a binasal. It takes a lot of other things, and it's not the only thing that we use, but having this little kind of frosting, as you can see, in towards the center of the lens and in towards the kind of nose in a V-shaped pattern means that the eyes can be more straight at the distance, and the eyes naturally converge or kind of come to a bit more of a V and cross in towards the bottom when we're reading. And that's why we keep it in that kind of a V-shaped pattern. Now, in addition to using binasals for our clinic, for our patients who have esotropia, we're also going to use photosyntonics, which you've heard me talk about syntonics a lot. You kind of see me showing you goggles all the time, but there are specific glasses that train the brain electrically by sending a signal to the muscles of the eye not to cross, but to actually pull out and line it more straight. So we're going to be using syntonics, binasals, and a lot of other activities and things to work on the eyes with in order to train the brain to align the eyes. Now, on occasion, we actually use binasals for patients who have a different form of strabismus, not esotropia, but sometimes we actually use them in cases of exotropia, where the eye actually turns out. Now, it's interesting that binasals can be used for that situation. You might think, well, if the eye turns out and you want to stop that, you could use something called a bitemporal, which you can actually, but we actually have found quite a lot of success in using binasals with exotropia patients if it's necessary at all. But the reason why it works for these patients is when there's this frosting in towards the center of the lens, it's kind of funny, but it really works like a charm for a lot of patients. It causes them to want to look at it and think, what is this? So it may actually teach their brain how to converge and cross their eyes when they've had an eye turn out. Sometimes really fast, within a couple of weeks. In fact, this is what I used for my son whenever he was just an infant, and he had alternating eye turn out. So exotropia, esotropia, strabismus overall is no laughing matter, and we have to figure out ways in order to train the brain to align and use the two eyes together. And binasals is just kind of one of those tricks that we use. Now, if you're wondering how you connect with us, if you're local, call us at 618-288-1489. If you're not local, then what we recommend you do is go to our website at visionforlifeworks.com and do one of two things. You can fill out a questionnaire there, or what you can do is you can click on the make a consultation and schedule a consultation direct with me so that you can talk with me one-on-one, face-to-face in a video consult to discuss how we can help you. I hope you like this information. If you did, like it and obviously hit subscribe if you've not subscribed to our YouTube channel yet. Also, if you know someone who could benefit, please pass our video along. Thank you.